Good morning, everybody. This is Chapter 4's lecture. I usually try to do these when this little person is taking a nap, but she doesn't feel very well and is insisted on being held, so she'll be joining us for Chapter 4's lecture. So let's just go ahead and jump right in. I will share my screen so you can see what I'm seeing. As we've talked about in the past, I'm not going to read this verbatim to you, because you can read. So I'm just going to be adding to some of the finer points. Chapter 4 is on learner differences and learning needs. You're going to take, and most of you are already currently taking, a very particular course on learner differences and learning needs. So we won't go into too in-depth because it would be redundant for you, but we will hit some highlights that you'll see on your PLT exam. So some key theorists from this chapter are Howard Gardner and Alfred Binet and Theodore Simon. Some of the key concepts that we cover are Howard Gardner and the multiple intelligences. I'm sure most of you have at least heard of them, if not taken some kind of inventory on what yours is. We'll talk about meeting the needs of all students from the perspective of the regular education teacher. I know a few of you are specializing in special education, so this will be very familiar to you, but we're taking the viewpoint of, as the classroom teacher, what is it like to have these students in our classroom? And then we're also going to talk about some suicide awareness and prevention, and this training module on the Jason Foundation is your Chapter 4 application exercise that you can find under the assignments for this week. So when it comes to language and labeling of students, it's really important that we use a person-first language. This means we're not talking about the disabled student. It is the student with a disability. It's not the autistic student. It is the student with autism. We don't talk about special needs students. We talk about students with special needs. The student always comes first. When it comes down to how to talk about a student, listen to how they talk about themselves. The text talks about this and how important this is for how we're referring to them, because we want to use what they're comfortable with. So when you're taking the assessment, just always remember that it's the student first. When we talk about intelligence, there's lots of different ways that we can think of intelligence. 2 ways are fluid and crystallized. On your study guide, it tells you that you need to know the mental, let me see how it words it. I'm sorry. Distinguish between the fluid and crystallized intelligence and the brain functions. So make sure you understand that with fluid, it's the mental efficiency. And this is our nonverbal abilities grounded on our brain development. It increases through our adolescence. Howard Gardner came up with the theory of multiple intelligences. There's 8 separate abilities. Most of these are pretty common sense. You can figure them out by what the words say: logical, mathematical, linguistic, musical, spatial, bodily, kinesthetic, interpersonal, and naturalist. The text goes into detail about all of these. I find the 2 that students struggle with the most are interpersonal and intrapersonal. Interpersonal is person to person, me to somebody else. How am I interacting with another person? Intrapersonal is me to myself. I'm spending a lot of time with my own thinking, my own thoughts, my own emotions. So those can be the toughest to keep straight. So make sure in your notes you do a good job of delineating between those 2. There's a good video there for you to watch. We're not going to watch it here, so go in and click that link yourself. That video on page 126, that's in your text. Last week I sent out a video that talked about some of the supplemental materials through the MyLab that can be really helpful. Those videos are super, super helpful in conceptualizing your reading. So I would encourage you to go in and watch those. When we talk about lessons for teachers, we want to differentiate instruction to connect with our students and help them understand their area of strength. What I have seen when people talk about multiple intelligences and how we use it in the classrooms, a lot of students want to tell me, well, I'm going to help my students learn it so that they know. it's more than just how do our students know how they learn. And when it's about how do we as teachers incorporate all of these different ways of presenting our lessons. You're not expected to use all 8 in every single lesson, or maybe not all 8 in every single unit, but you really do need to have a variety, so that students can hear the information in a variety of ways and in different ways. So when we talk about using the multiple intelligence as a teacher, it's more than just students knowing it for themselves. It's how do we use it to present information and present our curriculum. So make sure you understand that. When it comes to measuring intelligence, Alfred Binet and Theodore Simon came up with an idea of intelligence quotient. That's what IQ stand for. The 100 is the average score. That means 50% of people are below 100 and 50% are lower. When we talk about IQ scores, we need to be very aware of what they mean, and you will be tested on this in this week's assessment. So make sure you have a good understanding of what does that number mean and how do we use it as a teacher. I really like how it says view scores as a general aptitude. If it's below 100, that doesn't necessarily mean that they're slow or that they have a learning disability or a cognitive impairment. It could just mean that they don't have that information or they haven't learned it yet. So this is a general aptitude. This isn't a finite answer of how smart a person is. So make sure when we're talking about IQs that this is just one of many ways that we could evaluate or measure the intelligence of a person. And we don't want to put all of our eggs in one basket. So we're just using lots of different data points, especially when we're talking to teachers or talking to parents. I'm sorry. Make sure we know how we're talking about it when we're talking to parents. Learning styles and preferences. Research supports the difference between visual and verbal learners. A lot of times these go hand in hand. You can see here we have a high-low spatial cognitive ability, visualizer, verbalizer cognitive styles. And it is helpful to have students learn their own learning preferences, especially as they get older. It helps with how they're going to study, what supplemental materials they're going to look for, how they can learn to advocate for themselves. You know, we've had those teachers where they only teach in one way. I had a high school history teacher who every single day we walked in, he wrote down notes on the overhead, we wrote them down. The next day we came in, we took a quiz. And that is how we did every single day. And for those students who aren't able to learn by writing or just by listening, they really, really struggled in the class. And those of us who are good with retaining what we write down, we were able to excel. So understanding those learning preferences. I'm not a very auditory learner. I don't do well by just listening. I do need to see it and I need to write it down. So knowing that has helped me advocate for myself in my own learning, as I'm sure you all know your own learning styles and preferences. But again, it's as teachers, it's how we're going to present that information. So moving on, so far, if you're using the self-checks in the MyLab, the IQ and the learning preferences are covered in 4.1 self-check and 4.3. The IEP starts with, you'll use self-check 4.4 for the individual differences in the law. So I encourage you to go through and use those. Again, 4.1, 4.3, 4.4, 4.5 are going to be the really good ones that you're going to want to use. So most of you have heard of IDEA. We really like our acronyms in education. The Individuals with Disabilities Education Act. This requires that we provide a free and appropriate education, we call it FAPE, for all students with disabilities. A zero reject means no student can be denied. If they have a need, they need to be, they're covered underneath this federally. It's a legal mandate. When it comes to defining disability, IDEA lists 3 different categories. Those are listed in your text, so I'm not going to list them off here. And then we talk about LRE. This is the least restrictive environment. This means that we have to educate students in the least restrictive environment. Just because they have one of those 13 listed disabilities does not mean we're going to put them in a separate classroom where they'll be all day long. We want them to be with their peers as much as possible. There's 3 different ways that this can be. We call it mainstreaming, where they are mainstreaming, teaching students with disabilities in a few general education classes as convenient. Integration is where we fit them into existing class structure. And inclusion is where we have them in the classroom as much as possible. In my experience, excuse me, in my experience, the schools that I have worked in, they're all moving towards inclusion as much as possible, because our research supports that students need to be with like peers in order to really benefit. Like we can't expect to close any gaps if they're never hearing grade level content. So they need to hear it and then get more, and that's where MTSS and RTI come into play. But again, that's outside of the scope of today's lecture, because you'll cover that a lot in some of your other classes. And if you have questions about those, feel free to reach out and I'd be happy to talk to you about them. But do know those 3 different levels of LRE, least restrictive environment. Inside IDEA, we have the IEP, the Individualized Education Program. This is a legal document that specifies the services that are going to be provided and who's going to provide them. Inside this, what you really need to know for us is who's a part of this IEP team. As the classroom teacher, you will be a part of that IEP team. Some other people that are on it are the special education teacher. The parents absolutely have to be involved. The school psychologist is usually the one who does the assessing, so they're included. There's an administrator representative. Sometimes it's the principal or the assistant principal. And hopefully the school counselor can be involved also. You do need to know the makeup of the teams, so pay attention to that. On page 142, there's a video of an IEP meeting that you can watch. Section 504 is part of the Rehabilitation Act of 1973. This covers students with special conditions who are not covered under IDEA. It is broken down into 2 groups: medical and health issues, and there's some examples there, and students with ADHD. Some students with ADHD are covered under IDEA, and it falls under other health impairment. So those students can fall into either one. The procedures and plans are developed by the individual schools, and there's some accommodation examples on page 145. If you have a student who has a 504 plan, the school counselor or the school psychologist will be in to talk to you about those accommodations. A lot of times they are for physical issues, students that need to use the restroom a lot, students that need to be able to have snacks available, students who may need to have a water bottle with them constantly. My last school, I had an 8th grader who was diagnosed as type 1 diabetic as a 6th grader, and her phone was her monitor, but we also had a no cell phone policy at our school. So we had to write a 504 plan for this student, even though she was managing her diabetes just fine, so that she could legally have her cell phone with her at all times. We still ran into issues when she chose to be on Facebook. I think it was actually Instagram that she got on during recess, and a teacher who wasn't aware of her 504 plan tried to take the phone away. But that document that we had created gave us a way to help the teacher understand that, yes, she can have her phone, but it also helped us have a way of helping the student learn to monitor the cell phone usage and help hold her accountable for staying within the guidelines of the school and what she needed for her health. So that's just one example of a 504 plan. There's lots. So students with learning disabilities. A learning disability is a problem with an acquisition in use of language, difficulty in reading, writing, reason, or math. Difficulties in reading is the most common learning disability. This can be anxiety around reading, difficulty recognizing words or letters, poor vocabulary skills, difficulty understanding and remembering what was read. That's problems decoding. These students will have a hard time understanding what they're reading because they're reading too slow because it's taking them so long to read the words. We want to focus on preventing a learned helplessness. This is when students expect that they're not going to be able to do it, so they just don't even try. So know what learned helplessness is. There's a couple of effective approaches to instruction. Those are listed there: direct instruction and strategy instruction. This is one of those things where, yes, this is really good strategies for use with students with a learning disability. These are also great examples of what's good for one is good for all. These are great strategies to use with all students, not just your struggling students. So these are good ones for you to know and have in your toolbox. Some general strategies: keep your verbal instruction short and simple. Don't give too many at a time. Have students repeat directions back to you. This might look like asking a student to, what was my directions? Who can tell me in their own words what we're doing right now? Who can repeat what Johnny just said in their own words so that students hear it more than one time and more than from just the teacher? Repeat main points if you can, and help them learn self-monitoring and memory strategies so that they can, just great strategies overall. So students with ADHD, attention deficit hyperactivity disorder. This is a pervasive pattern of inattention, impulsivity, and hyperactivity. Use the lessons for teachers from your text. Again, give small assignments at a time. Help develop skill and will to improve and self-monitor. And help them discover what they're good at. They have lots and lots of strengths. And unfortunately, students who struggle, especially those that with the inattention and impulsivity, they spend a lot of time hearing their name negatively. Johnny, sit down. Kayla, that's enough. Put your pencil down. Why are you over there? Come back over here. So helping find what they're good at and utilizing those strengths is very, very important for these students. You want to know these suggestions for students with ADHD. There's a good chance there's a question on your exam this week about what to do and what are some good strategies for working with ADHD students. Giving them choices, using visual clues, creating opportunities for movement. A lot of times these students were my helpers when I needed an errand ran because, again, so often they are just hearing their name negatively. So being able to really feel valued is really, really important. Here it says privacy regarding medication. This is vital. You can never talk about the medication of a student in front of other students, ever. You would never say in front of the entire class, Kayla, did you take your medicine this morning? You would never have a conversation with the class that said something along the lines of, well, we all know that that Elizabeth requires special help in order to sit in her seat and she didn't have it today. It's a violation of FERPA, which is another legal mandate for educational records. So never talk about medication in front of the class. If you do need to ask a student about their medication, ask them very, very privately in the hall because you don't want anybody else to overhear. And there's a good chance that you won't know if students are on medication or not. They don't have to tell you. So students with communication disorders, there's some good information for you there. They are the second largest group served by special education. Students with behavioral difficulties. These are when emotional and behavioral disorders interfere with the child's growth and development. This can include inappropriate behaviors, unhappiness, depression, fears, anxieties, difficulty, or relationship difficulties. IDEA specifies characteristics of emotional disturbance. So there's some classroom behaviors. It can be combined with other disabilities. You're going to need to know what are some good strategies of working with these students, how to build a relationship. That's the biggest piece of advice I can give you if you have a student who struggles with behavior. I'm sure you guys have seen like the quote or the meme that's going around is if you replace the phrase attention seeking with connection seeking, our perspective changes. And this really speaks to behavior difficulties. These students a lot of times are really, they struggle with behaviors, but they're also just really want to build that connection and that relationship with their teacher. So build that trust and get to know them as little people can be really, really helpful. While at the same time, keeping in mind the safety of your other students and how you're going to use your classroom management to handle some of these more difficult students that you may come across. I would highly encourage you to watch this video on page 154 of your MyLab e-text. Here's some ideas for disciplining students. And they talk about having a written behavior contract. That can be really helpful so that students know what's going to happen if they do this. Some other suggestions I have is be clear and be consistent. Say what you mean and mean what you say. Make sure you're going to follow through with what you're doing. Try not to have the consequences built on themselves. One of the biggest things I've seen teachers struggle with when working with students with behavioral or emotional problems is teachers struggling to reset and start over either the next day or that afternoon or the next hour. Because it can be really, they're really challenging and they wear on us. But if we have the ability to reset and say, it's a fresh day, it's a fresh hour, it's a fresh minute, whatever it is that you need to say in your mind, and communicate that to your student, like, okay, that happened, it's in the past, we're moving forward. I know that we're going to have a good day from here, is really, really, really important for these students. So now to the suicide and drug abuse. In Kansas, in May of 2016, we signed into law that every teacher needs to have a minimum of 1 hour of suicide awareness training. There are some warning signs there. There are the facts and the myths. Just to cover a few of those. The majority of people who are contemplating suicide talk about it. If we ask them about it, we're opening up a conversation. We are not upping the possibility of them following through. That used to be a common misconception, and I think it is still pretty common, where if I ask them, I'm going to plant that seed. If you feel like you need to ask them, they're already thinking about it. You're not planting the seed. You're not watering it. You're opening up the door to have a conversation so that they can feel like somebody cares. If you are concerned about a student, or now that you're a college student, a peer, or a friend, the best thing you can do is ask, are you thinking about killing yourself? Don't ask, are you thinking of hurting yourself? Ask them, are you thinking of killing yourself? And then based on how they answer, you can follow up. The next thing you need to know is, do you have a plan? The third question you ask is, do you have a means to that plan? I was a school counselor for 3 years. I owned and operated a private counseling practice. So I had this conversation a lot of times, and we are not asking teachers to become counselors. But what we do need you to do is be aware so that if you have a concern, you can start that conversation because you already have that relationship with the student, and then you can go get help from the school counselor, the school social worker, the school psychologist, the principal, somebody that can come assist the student. When it comes to suicide, we react every single time. I used to have teachers that would ask me, well, aren't they just begging for attention? And my response to that is, if this is the way they're asking for attention, I will give it to them every single time until we can get them the help they need so that they have a different way of asking. So just something to keep in mind. We do know that some people, when they are contemplating suicide, will start to give away prized possessions. They'll start saying goodbye. We do know that not everybody who is suicidal wants to die. They're in pain and they want the pain to stop. So they a lot of times are asking for help, even if they're not using the words, they'll use other actions. Suicide affects all demographics, all social economic statuses. So it's not just one type of person who does this. It's all kinds. So don't think, well, oh, they're so happy, they would never do this. Oh, they have everything going for them in their life. They have a lot of money. They have a big family. Everything looks perfect. They would never think about doing that. It can happen to anybody. I think that covers most of it. So if you have a concern, start the conversation with them and then reach out. If you are concerned about yourself or a friend or a colleague, please start a conversation with them. Reach out to me. I am happy to assist in any way that I can. I can tell you that I've walked several students over to the counseling center, both before and after this lesson. I've had a lot of students reach out saying, I'm kind of concerned about my friend because of X, Y, and Z. What do you think I should do? And I've been able to help you get your friends help, because we want to save all the lives that we can. So please just don't hesitate to reach out now, in the future, this semester, next semester, 5 years down the road, whatever it may be, reach out to me. I'm here. When it comes to drug abuse, you will need to know that 25% of high school seniors report using drugs in the past 30 days. 1 in 4 have used some sort of illicit drug, marijuana, alcohol, inhalant in the last 30 days. Make sure you know that. Both in general because of the prevalence of drugs, but also because you have, there's a good chance there will be a question this week. So what can you do as teachers? As you can see, this is kind of a soapbox of mine, so I already spent a lot of time talking about this. Take every attempt, comment, suggestion seriously. We never say, well, they're just joking, or I dealt with this last week, or this is the 3rd time that I've talked to this student. We react every single time. The questions you need to ask: are you thinking of killing yourself? Do you have a plan? Do you have the means? If they say they have a plan, do not leave them alone. You are in a school. You're supposed to be teaching, but a student just said, yes, I'm thinking about shooting myself. I know where my dad keeps his gun. Call the office, ask for somebody to come cover your class, walk the student down to the school counselor, or call the school counselor or the school psychologist and say, can you come to my room? Don't leave them alone. You obviously need to care for your other students in your class also. But those are just some good strategies for how you can react right then. Make sure you know the staff and the resources to help. Again, school counselor, school social worker, school psychologist, your principal. That might be your secretary. That is had some specific training in it. You never know. When it says notify parents, I would reach out to your school resources and ask them to help you talk to the parents. Never, ever, ever agree to not tell. Never. They might just try to tell you, oh, I was just kidding. I'm just overwhelmed. I'm just stressed. I would never do that. We never agree to not tell. We can't. We already talked about being a mandated reporter for abuse and neglect. This is just as important. And I always tell them, your life is too important for me to make that promise to you. What I can do is I promise I will be here with you every step of the way, and I will help you get the help you need. But I'm right here. But never, ever promise to not tell. So moving on to autism spectrum disorders and Asperger's syndrome, we're almost done. Here's where I have a little bit of a disagreement with our text. Yes, autism spectrum disorders used to be part of pervasive developmental disorder. Some medical professionals still refer to it as PDD, pervasive developmental disorder. It is a developmental delay. It significantly affects verbal and nonverbal communications and social interactions. We see a lack of eye contact. They won't share, they have a hard time interacting with others. They specifically have a really hard time of engaging with others about topics that they're not interested in. They really like consistency with schedules, and they might have some things that they always need to make sure that happen. Maybe doors close, only red cars can be played with. Some of them have sensory issues, so tags on their clothing can be really uncomfortable. Asperger's syndrome is no longer a diagnosis that is given. It is a part of the autism spectrum disorder. It used to be its own separate diagnosis. We used to think of them as extremely high functioning on the spectrum. It's still thought of that way a little bit, but it's different because every single skill that I just talked about, the social interaction, the eye contact, the verbal, the sensory, each individual is going to fall in a different spot on their spectrum in those areas. So no two students on the spectrum are alike. If a student tells you that they are Asperger's, don't argue with them. Don't say that's not a thing. Don't say that's no longer a diagnosis, because that's how they identify. Just understand what that means in the back of your mind when it comes to being on the spectrum. I hope that makes sense. If you have any questions, please reach out and ask. Last slide, working with students who are gifted and talented. These students are very bright, creative, very talented. They're a joy oftentimes to have in the classroom. They can struggle with depression, boredom, being frustrated, feeling isolated. I see a lot of anxiety in these students, anxiety with a fear of failure because they have been expected to be above for their entire life. They sometimes struggle to take risks. They won't step out of their comfort zone and try things because they are afraid of not looking like they are gifted. So really encouraging that risk-taking and setting up an environment where mistakes are okay can be really helpful. Try to help them learn to not put so much pressure on themselves. So, and then there's some characteristics of identifying. You will need to know, and they're covered in the text, strategies for working with these students in your classroom. So be prepared for that. Make sure you're using your study guide as you go through, as you prepare for this Chapter 4 assessment, using the videos that are in the MyLab, and please use the self-checks. They can be very, very helpful in learning how to understand the questions as they're being asked. When you're taking the chapter exam, make sure you're reading the full question, asking yourself, what is it asking me? And read the full answer, because a lot of times we need to make sure that the whole thing is correct, not just the first half, not just the second half, but the entire answer is correct. If you have any questions, tanaarnold@ksu.edu. I'm here to help however I can, and I will send out an email with everything that's due this week. I will have your application exercises and your discussion boards graded very, very soon for last week. So look forward to hearing from you. Take care.